Greetings. Let's get this out of the way. If you go to a doctor for anything, you're going to get upcoded. You're just going to get upcoded. Upcoding basically means that the code they're going to use to send to your insurance company or just to you if you don't have insurance is going to be higher than it's supposed to be. The problem you have is that even someone like me can't really prove it based on what the qualifications are. For instance, in a previous video, I talked about how I went to see my doctor to have a physical, and I shared some information. He offered a couple of suggestions. Next thing you know, he coded me much higher than what I felt I should have been charged. And I have the manuals. I could look it up. I called them and I said, this doesn't fit the qualifications. In his eyes, it fit the qualifications because he offered some suggestions for a couple of things. But it didn't fit the qualifications listed in the manual. Well, one of the things that you start to find out is that just because you have a manual and you're looking at something that's coded a certain way or written a certain way does not necessarily mean that doctors are going to follow that. Heck, a lot of hospitals don't follow that stuff either. The thing is that hospitals have more oversight. For instance, if you're upcoding and you're sending a bill to Medicare or Medicaid, a lot of times Blue Cross, you're going to be in trouble because they're going to catch it and they can just hold the money and not pay you. So hospitals really have to watch out for that. Medical records people have to watch out for that. But doctors' offices, almost nobody is checking that. Now, I could just say this off of my one doctor and someone would say, oh, well, you're just showing, sour grapes. It's not just that one doctor. I go to podiatrist and I know what I'm getting when I go there. But I was talking to him about going to see my primary care doctor and how he upcoded me. And he says, well, I'll tell you the truth. I do the same thing. I have patients who come in for certain things all the time. But if they throw something else in there, then that's now another level of care, in my opinion, and I'm going to upcode that. And I said, well, but you're not really doing anything different and you're not spending another 5 or 10 minutes with them. He says, no, but it's another complexity. And based on what I was taught, as far as how coding is supposed to go, if there's a complexity involved, that goes a little higher. I also have a sleep doctor. Now, it's not the sleep doctor who told me this. It was his PA, yet I know it's the same thing. So I asked her one time, I said, how am I getting charged the level 4 when I'm basically in here for only 5 minutes? There's nothing to do. You're just checking me because you have to. Every year, I have to have a follow-up. It's 5 minutes and I'm gone. How am I getting a level 4? And she says, you get a level 4 because I put a stethoscope on you and I check your breathing. I said, wait, I get a level 4 because of the stethoscope? What if I say I don't want it? She says, well, you actually have to have it because it's part of the treatment that we're supposed to do. So I said, so there's nothing I can do to not get coded a level 4. I'm supposed to be like a level 2 or level 3, which fits the criteria a lot better based on how it's written in the manual. And she said, if I put boy, that's hard to say right now. If I check your breathing pattern, it's a level 4. Wow. So I can't turn it down, but if you do it, I'm getting a level 4 as opposed to a level 2. For a lot of you folks, you may not necessarily understand, but in essence, if you're going to a physician, the difference between a level 2 and a level 4 could be as much as $100. And I'm not saying that it's that for everybody, but it could be that. It actually could be $200 in some larger cities. So this is a big deal. Insurance companies not going to pay all of that all the time. If you're lucky to have what they used to call a Cadillac plan, which basically says you pay $5 every time you go, okay, that's not a big deal for you. But if you don't, I'm self-employed, so I'm on the New York State Exchange, then everything goes to the deductible. But so the amount that they say they pay, they're not really paying. There's a discount, but I still owe more money. So I'm being upcoded. My eye doctor, who I saw, they had this series of tests that they had to do on me a couple of years ago, and I got this bill for $1,500, and I called up and said, wait, what is this? And they said, well, these are all the services we did, and your insurance company put everything to the deductible, and there's your balance. I'm like, $1,500. So I went in, was it September, I believe, and they wanted to do all these tests. I said, oh, no, that's not happening again. I just saw this doctor over here. I got to go to my diabetes clinic. You know, when you hit a certain age, you're seeing a whole lot of different doctors. Just get used to that, too. So I said, no, we can't do all of that. Not going to happen. So she goes and she talks to the doctor, and they come back and say, okay, there's just one test that we really have to do because we have to check your eyes for such and such. Okay, so I get that one test. Now, when I get the bill, it's around $275. Way better than $1,500, and they didn't upcode. They coded exactly the way it was supposed to be, not only for the test, but for the visit. No problem with that. $275? Okay, I get that. My diabetes clinic, basically they're coding exactly what it's supposed to be. Now, I don't go in there telling them that there's anything else wrong. Luckily, I see someone else for my feet, so I don't have that. I see someone else for my eyes, so they don't get to charge for that. Whew. I don't know really if there's anything to do about this except to tell you folks that you need to look at your medical bills. You can ask your questions. You're probably not going to be satisfied with it. And unfortunately, there's little you can do. Hospitals are a different story. There's sometimes things you can do. You have a medical director. If, like I said, if you're on Medicare, you can report it to Medicare. You can report it to Medicaid. You can report it to Blue Cross. There's nothing you can do for a physician. You can report it to Blue Cross all you want to, but there's nothing they're going to do about it. That's just how it is. So this is not an uplifting video. This is an informative healthcare video. Y'all just need to know. I know. Don't like it. Like I said, I have a lot more pull with hospitals than I do with physicians. This is why I don't trust a lot of physicians. I hate to say that, but I don't. Anyway, my name is Mitch Mitchell. Let me know your thoughts. You take care.